When people are talking about women's heart health, they're generally talking about the whole cardiovascular system. And so one thing that we know about cardiovascular disease in general is that it's quite common in women. And since 1984, it has been more common cause of death in women than men, actually. And that has been rising over time, whereas men's cardiovascular deaths have been decreasing over time. In terms of heart disease, women will have chest pain just like men. So we talk about the fact that women are different than men, and certainly they can be, but chest pain is going to be the most common symptom still, and so women should not ignore chest pain if they have it. The prevention advice I don't think has changed over the last 50-some years, but good old-fashioned diet and exercise is what it comes down to. But in addition, you need to know all of your risk factors, and there are a whole host of them. So a woman needs to know what her blood pressure is. She needs to know her cholesterol, her good and bad cholesterol, her triglyceride level. She needs to know how her sugars are running. Having excess weight and not exercising regularly are other risk factors. Maintaining a normal weight or getting to a normal weight if you're not at one. This is important for younger women to start early in hopes of maintaining, because once you're down by 20 or 40 pounds, it's a lot harder to lose it. And then just eating a healthy diet, and I think most people actually know what a healthy diet is, but they don't always follow it. The whole basis of our center is to take things that we know that are unique about women and identify those things or apply that information. There's been a decade now of research on how women are different from men. So we're really trying to use that knowledge that we have to make sure that we identify women correctly if they're having a heart problem, do the right tests on them to make sure that we get the right diagnosis. We also have a support group here for women that have been diagnosed with heart disease or had heart attacks or had bypass surgery just because of the emotional stress that goes along with all of this and how that affects how they feel. That's an important part of their overall care. So it's not simply the medicines and diet and exercise, but also addressing that stress component. I think the biggest thing that we need to do is eventually just start naturally treating women like women, as opposed to having to have special centers like we have now where they have to come, and we're thinking about them that way, and hopefully their doctors and cardiologists will always think about them a little bit differently when they come in, you know, once the information is well disseminated. But I think we have a few years until that time.